In this lecture, we are going to discuss Proteus. We will cover the all aspects of the Proteus. So without wasting time, let's get started. First of all, we will look at the general properties of the Proteus. Proteus is a gram-negative bacteria and it is rod shaped. So that's why we can call it as bacillus. And it is the most important cause of the UTI, urinary tract infection, due to its motility and the different factors that we will discuss later. And it is non-spore forming. It doesn't produce any spore. And the most important feature in the laboratory that through which we can diagnose easily is the swarming effect seen on the blood agar. So next, there are a lot of different species of the Proteus. So most important, clinically important, is the Proteus mirabilis and the Proteus vulgaris, Proteus spanneri and the Proteus houseri. So these are the different species of the Proteus, but the most important species is the Proteus vulgaris and the Proteus mirabilis. So why do Proteus shows motility effect or the swarming effect on the blood agar? So due to the flagella that surrounds the Proteus. So this condition, when the bacteria having flagella all through its body, and this condition is actually called the peritrichous conditions. Flagella cover whole bacteria. That's why it shows the most importantly, it shows swarming effect on the blood agar. Next, we will see culture properties. As we have already discussed, on the blood agar, it shows the swarming effect. So that is the most important thing through which it becomes helpful in the diagnosis of the Proteus in the laboratory. On the McConkey agar, you will see NLF, non-lactose fermenter. Proteus is a non-lactose fermenter. It doesn't ferment any lactose present in the McConkey agar. So that's why it will look colorless on the McConkey agar as compared to the lactose fermenter, because lactose fermenter produce pink colonies, but Proteus will produce the colorless. Why it will produce the colorless? Due to the non-lactose fermenter effect. Next, we will see the biochemical testing through which that will help in the specifically diagnosis of the Proteus. So, lot of different tests are positive and some are negative as well. So, catalase will be positive test in the laboratory. Urease, the most important feature. Proteus will produce the urease enzyme. So urease test will be positive by the Proteus. Methyl red will also be positive, and in case of negative, you will see oxidase test, Proteus oxidase test will be negative. Vulgus Proskauer test will also be negative. But important thing, in Dole test, you will see two different conditions. Proteus vulgaris will be positive. This species of the Proteus in Dole test will be positive, while the Proteus mirabilis in Dole test will be negative. So two most important things which you have to remember, different species shows different effect. Vulgaris will be positive in Dole test, will be positive in case of vulgaris, and in Dole test will be negative in case of mirabilis. So that is the important features that helpful in the differentiations of the different gram-negative bacteria. Next, we will see the virulence factor. These are the factors that helpful in the spreading of the disease in the human body. So first and the most important is the urease. Proteus produces the urease enzyme. Now this urease enzyme converts the urea into the ammonia, because urea is present in the urine of the human. So urea is converted into the ammonia with the help of the enzyme urease produced by the Proteus. Due to the productions of the ammonia, urine pH start increasing. So it will go towards the alkaline condition, because 7 pH will be neutral, and 14, if it start increasing, it go towards the alkaline, and if it is start decreasing below the 7, then it will be the acidic condition. But in that case, the pH of the urine will be alkaline. It means that the pH will be greater than 7 in that case. Steroid strand formation will be seen in case of Proteus infections. You can also see the fimbriae. Fimbriae present on the surface of the Proteus. It will helpful in the adhesion of the Proteus with the wall of the urinary tract. So if it gets chance to attach the urinary tract, then the probability of causing infection will also be increased in that case. Flagella helpful in the movement of the Proteus from the urethra in the ascending direction. Like it can first enter into the urethra, then it can go towards the urinary bladder, then it go towards the ureter, then ultimately it can reach towards the kidney. So the infection will be in ascending order. So due to the presence of the flagella, that helps in the motility of the Proteus. Proteus can also produce the endotoxin because it's a gram negative bacteria, and gram negative bacteria having endotoxin in its surface, and that cause the inflammation in that case. In the clinical manifestation, you will see the UTI, urinary tract infection. If the infection is in the bladder, then it will be the cystitis. If it is in the kidney, then it will be the pyelonephritis. And in that case, the most important thing, urine will be alkaline, and the smell of the urine will be ammonia-like. And in that case, you can also see the crystals steroid like magnesium ammonium phosphate crystal, triple phosphate in that case, uh, because due to the presence of the steroid strand in the urinary tract. Proteus can also cause infection in the wound, and it can also cause the septicemia in rare cases, but it can cause the septicemia as well. In the laboratory, what sample we will take for the diagnosis of the Proteus? We can take the urine. According to the manifestations, clinical manifestations, we can take the sample of the urine to check the UTI. We can also take the sample like pus to because Proteus can also spread in the wound as well. And we can also take the samples of the blood because it can also cause the septicemia as well. Antibiotic sensitivity, what antibiotic will be helpful in killing the Proteus? So aminoglycosides, cephalosporin, and the carbapenem. But the most important criteria, that the decision of the antibiotic will be done after the antibiotic sensitivity testing. Which antibiotic will be sensitive towards the Proteus, and which antibiotic will be resistance to the uh, Proteus. So that will helpful in the treatment of the infections caused by the Proteus. So this is all about the Proteus. If you still have any question, you may ask in the comment section. Thank you so much.